I know you talked a little bit about your experience with ketamine and your IBS and healing your gut. And I would just be curious to hear your thoughts on how that experience was and if it was positive for you, if it's something that you may recommend for people to explore if they're having difficulty resolving their gut issues. Just give the listeners a little insight because that's a pretty cool treatment.
So for me, I had had a parasitic infection about 4 years ago and struggled with functional IBS for years. And my gut was in significant dysbiosis and the bacterial profile was off, probably from the parasite. And like I've always just been in this perpetual state of stress that I thought I had well managed because mentally I felt okay, but my
Sure.
hormone profile was all off. I was gaining weight kind of uncontrollably almost. My training was garbage for a while. So went to a clinic and did it. And within the first 3 weeks of doing it, I noticed a giant change in the quality of my stool, the frequency of it, the
Sure.
foods I could tolerate, a my mental
Yeah.
health, my mental health. And so it's like looking at the enteric nervous system of we all know, or maybe
Yes.
people haven't listened to this podcast, our brain and our gut are directly tied together. So if we're always in this constant state of stress, even though I didn't feel it mentally, my body was dealing with it physically
Yeah.
down in the gut.
Absolutely.
So ketamine actually technically kind of rewires the brain in the sense of the way the neuronal circuits are working. And it's really just helped me from, yes, my kind of nervous system, it doesn't get ramped up with like the little stressors anymore of like, oh no, there's no ruminating or catastrophizing as much, which I think has really changed it. And there's actually, I had looked up some studies. It looks like there are some promising studies out there where there are studies showing ketamine can change the microbiota of the gut.
Thank you so much, Brett, for taking the time out of your day to meet with us and chat with us and
Of
educate us
course.
on all things strength training and physical therapy. So
Mm-hmm.
we just dive right in here. So, Brett, tell our listeners a little bit about what you do. I know you're a very successful business owner of Architect Fitness and Barbell Therapy. How long have you been in business for?
Well, thank you for having me on, Kelly. So I have been in business now since 2018. I started the physical therapy practice, but my coaching goes back all the way to when I started my career as an exercise physiologist. So I started personal training back in 2010
Okay.
and haven't looked back since then. So it's
Mhm.
been 12 years as a professional in this field now, I guess, and then about 7 years or so as a physical therapist since I finished school. So yeah, I started my business right out of school doing some powerlifting and Olympic weightlifting coaching. So they'd been into it. And then really what happened was as I was in school, I just saw that when I was spending more time with people as a personal trainer or strength coach, I could do a lot more with them. And we would send people to physical therapy because I wasn't a physical therapist yet. And they would come back and I was like, how's PT? And they're like, well, I stopped because they just gave me the same stretches and I was paying to go lay on this table and stretch by myself when I can just come here and do that with you or like, not waste my time and money over there doing it. I was like, okay. And then when I was in PT school, I realized that we didn't have a lot of time with patients, or I was treating three, sometimes four patients at once, and I couldn't give anyone the attention that they needed to educate them or be hands-on with them and teach them how to move better or understand how to live their life with a better quality of life. And I realized something was missing in the medical model, so I went out and started barbell therapy as a way to kind of be the in-between of someone that has that strength and conditioning background as well as the rehab background. But we practice in a very different way where we're giving everyone an hour of our undivided attention where we're doing manual therapy, educating them on why this thing happened, what happened. And then most importantly, as a strength coach, which a lot of physical therapists don't have a really good understanding of strength training, is I've traveled that journey. I've done bodybuilding, powerlifting, Olympic weightlifting. We know how to get them back to sport better than most people do just because we've walked the walk and it makes it much easier to rehab someone when you know what their daily demands are, whether it be bodybuilding, CrossFit, weightlifting, any of that stuff.
Mhm.
Exactly.
Absolutely. That's awesome. It sounds like you kind of found a problem within the structure of the industry that you were going into, and you were an innovator and kind of finding a way for some middle ground. Like, I want to get these people back into their sport. I don't want to tell them that they can't go back to it. And I feel like so many athletes might hear that. And Kate, I know Ty, so basically my brother-in-law. Kate is my mentee, but also basically my sister-in-law. Ty was really deep into football. He definitely got a few injuries, and like I know he's also pursuing physical therapy school now because he's kind of gone through the ringer and he's kind of been through it. So kind of similar to Brett's journey,
I
which is
think
pretty
it's
cool.
very, yeah, I think it's very, when you're in sports for that long, it's just so installed in your brain. You're like, that's the path I want to go into because that's what I've been doing for my whole life. And I think that's really good because they're getting that background and they can help people that are like in football or in this different kind of sport and have that background to really see where this person needs to be and know what they need to do in order to get back to that.
Yeah, I think something important there though too is a lot of people go as physical therapists. A lot of people played sports, and I might sound like a negative Nancy here, I guess, or a bit of a
Okay.
pessimist, but these are just my true feelings on things. So
Yeah.
one of the biggest things I see in this field is people like, yeah, I'm going to this sports PT or whatever, and it's like you look at their profile or whatever, it's like, okay, cool, you played soccer in high school, great. Or some people it's even like, cool, you played soccer in like elementary school.
Mhm.
Sure.
That doesn't make you a coach. Maybe you have
True.
like an athletic mindset, but having a true understanding of strength and conditioning and how to create contextual barriers for people and set up the right exercises and progress them through that is really more of the important part I see in getting them back to sport. Yes, we need to understand the demands of the sport and everything too, and the mindset and psychology that goes into that. But on top of that, as a PT, we also need to know what what the components of strength training are and
Mhm.
how to really get someone back. So for people that are listening to this, like if you're an active person that lifts weights, plays sports, whatever, you need to find a physical therapist that likely strength trains themselves or has at some fairly significant level at some point in their career. Because there's just such a difference I see with the people that get that because it's great to be able to do, we do dry needling, we do joint manipulation and adjustments and soft tissue work and shockwave, but like that's just rehabbing the initial injury. But the thing is, and what a lot of people don't realize, like bodybuilders a lot come to us. It's like, oh, I just need to come in and get dry needling. And it's like, well, you didn't get hurt because you didn't not have dry needling. Something precipitated this that made this happen. And so it's getting back to the why of what made that happen and then making sure we're getting them to an adequate point where those stressors are no longer an issue for them, that they can sustain those stressors and not get hurt in the future, which is where a lot of people will go to PT. They'll get better, maybe because the PT told them to stop doing XYZ, which isn't always the cure for it either. Or it's like a lot of people will come to us where they've done PT, they felt better, but as soon as they went back to sport or their activity, things got went back to how they were because they simply removed that stressor, but then never re-exposed themselves to that stressor in a way that it gave them enough exposure to build the capacity to repeatedly handle those loads, stressors, forces, whatever it might be. And so then they continue in the cycle of getting hurt, which is like, there's for me, being a strength coach is more even the important part than a therapist because I actually know more more strength coaches I would send a family member to for an injury than some PTs, especially someone
Yeah.
that's active.
Mhm.
Okay. That's really interesting. So, Brett, question for you. Did you ever experience a really severe injury like throughout your training that maybe also contributed to inspiring you to get into PT?
Um, so my way into PT was a bit of an interesting one. So I did play football and hockey and baseball as a kid, and I'd get banged up, especially
Yeah.
when I played football. I got what was called Osgood Schlatter, which is
Okay.
a
Yes.
condition of the knee. Jumper's knee is kind of a common name for it, but basically,
Okay.
it's a soft tissue injury to the patella tendon, which almost ended my football career, and by the end kind of did, because it was just too much too soon between hockey, baseball, football. It really wore my knees down. I was just growing too fast too at the time. And I went to physical therapy for that, and it helped. And then in football, I sustained a pretty bad hyperextension injury once, which took me some time to bounce back from, and I went for that. It helped.
Yeah.
But I actually originally went to school for music, performance. I'm a
Oh,
drummer, and
Interesting.
then
very cool.
I
That's so
realized that was not for me. That was not the course of action I wanted to take with life. I wanted something more stable. I was good at math and
Sure.
science. So I went into engineering, actually.
Okay.
And then once I started that, I did a semester there, and I actually did really well, but I just realized sitting behind a desk all day and basically I thought, I was going to be building robots and like changing the world
Sure.
with robotics or something, but I realized most of it is
Yes.
just answering emails and doing computer work all day and not having a lot of social interaction, which I really love social interaction. I'm a social creature.
Yeah.
So, but at the same time, I started working out with a good friend of mine still, and he was a biochemist, and he was really into bodybuilding and nutrition, and how using certain methods could improve certain aspects of performance and fitness and weight
Sure.
loss, and so I got into all that type of stuff, and his I was like, man, I really like this stuff. Like I'm going home and just reading nonstop about it. I was obsessed with it because I also was fat and didn't like the way my body looked at the time. And
Okay.
but I was actively doing things to change it. And um
Yeah.
I didn't like um I didn't like what engineering had to offer me. Um and I was like really on this, but I was like, being a trainer just doesn't seem like enough for me. It's like it wasn't a stable career path. It was a career path that had a very kind of a ceiling to it. And then his
Sure.
girlfriend was actually in physical therapy school at the time, and it just kind of dawned on me. I was like, you know what? That was a really cool environment where I can work with people. There's a very rewarding satisfaction to it, and you got more into the depths of why something was wholeheartedly as a system. So that's why I ended up choosing to go into physical therapy and never really looked back on it from there.
Very cool. I love that. That's really cool. Where you mentioned that you kind of got into training and fitness because you were unhappy in your body. Would it be okay if we unpack that a little bit more?
Sure.
Okay. So when it comes to your body image, when you kind of first started getting into fitness, how old were you?
So I grew up, my dad always worked out actively, so we had a little
Yeah.
home gym in the basement, and I remember
Okay.
being a kid and he would lift weights, and I might have been 11 or 12, and he started letting me bench
Okay.
press and do some curls and leg
Nice.
press and stuff with
Yeah.
him. And then um, when I started playing football, when I was in eighth grade, my coach, I was best friends with his son, and he was one of the coaches for the high school. So he was like, come to the field house. So good old Tewksbury Field House. We'd go down
Oh,
there multiple
good
times
old
a
times.
week. And, I was in eighth grade, but I was lifting with the seniors and stuff, and just so inspired
Ooh,
to get
so
stronger. And
cool.
and I really started then for training for football and things. And then
Cool.
after my high school sports career ended, I started to get put on some more weight again, and not liking the way I look. So I joined Gold's Gym in Tewksbury and then started training, and then had a couple guys take me under their wing, and then I kind of got into bodybuilding for quite a few years from there.
Very cool. That's awesome. So for those that don't know, I'm from Tewksbury. Brett's from Tewksbury. Brett's a little bit older than me, so we didn't really go to school together, but we're both from Tewksbury. Kate's from Wilmington, so the next town over. So pretty funny that we all are in that same area. Gold's Gym. Those are the days, man. I love that gym. Now it's a jujitsu gym, I think. hopefully
Yeah.
try goes there now. So
Yep.
that's awesome. Very cool.
I
And
actually
so,
go to that gym, which is so funny. Yeah.
yeah, I
It's a
love it.
big circle.
Yes, it is. Small world. So when you were kind of struggling with that body dysmorphia, it sounds like you got into bodybuilding as a way to kind of, I don't want to say cure your body dysmorphia or your dissatisfaction, but I know that you transitioned from bodybuilding to Olympic weightlifting, powerlifting. What inspired you to change? What was coming up for you when you had made that decision to go from bodybuilding to weightlifting?
Well, I want to back up here for a second. I don't think I had body dysmorphia. I
Okay.
objectively did not have healthy health metrics as far
Okay.
as, objectively, like I had a larger waist than I should. I had
Sure.
a high level of body fat. Um, so it wasn't just that I didn't like the way I looked, I just wasn't living a healthy lifestyle for a little bit, and then I did. Um, but what made me change from bodybuilding to weightlifting?
Yeah.
So I I'll say this. I was from um freshman year of high school, or no, I turned 18. So whenever I turned 18, I signed up at Gold's Gym the day I turned 18. And so maybe a junior or senior in high school. I must have been a
Okay.
senior. So my senior year in high school, all the way through college, I was basically, so about 5 years, I was doing the bodybuilding thing, and I had made significant changes in my body over time. Um, and like I was into bodybuilding, following the bodybuilders, but I just think in general, I didn't have the genetic coding to, be a professional natural bodybuilder. And I also
Sure.
didn't want to live that um restricted of a lifestyle, as I would call it, for the things I valued, my friends, and I did like to go out and, have some beers with friends and things and have a fluff social life, I guess, in a sense. But
Yes.
um, I might drink one night a week or something, but I never had it was always really a struggle for me to, lean out and continue to hold on to muscle and things. And so I was relatively happy with my body, but it was like um you're just like continuing like jamming your head against a wall, looking for these slow results over time. And for me, when I started a PT school was very overwhelming in the sense that like they told us we couldn't work more than 10 hours a week, and that
Okay.
like we'd all gain like the first year 20, just
Yeah.
because of stress and everything. And so um, I actually had started dating a girl that had been in strength and conditioning, and she could do the Olympic lifts pretty well,
Yeah.
and I couldn't. So
Okay.
I was like, I can't let her beat me. I need to do these.
Right.
And I'm like, I'm gonna figure these out. And I was super, you know, uncoordinated with them at first, and it took me a while to really start to learn. But when I first got into it, it was, this is a full body workout. I can do hang cleans and snatches and stuff in a short amount of time, and really get a decent full body workout in within like an hour, instead of like, wasting time doing biceps or triceps or whatever. So that's
Sure.
what kind of started it for me.
Okay.
Um, and then I was kind of self-taught for a while. I actually went into my first competition without any real coaching. I luckily had a friend come that day with me that's done it, and like guided me
Awesome.
through the ropes. I can't believe I did that looking back now.
That's crazy.
Because I never
Yeah.
suggest anyone
It's
get
like, don't do
into
what I did.
don't get into weightlifting without coaching, because I really wasn't good at the time. I had no idea what I was doing, but um,
Yeah.
I've learned a lot since then. So
Yes.
um, let's see. So, but then I did my first meet at Architect Fitness, which is funny because I walked into that gym. I was like,
That's
I'd love to own a place like this, and now I actually own that place. But
that's a riot. Full circle moment.
Yeah.
yeah. So, anyways, I had hired a coach, and I was like, yeah, I want to cut weight. He's like, no. He's like, you're a 94 kilo lifter. I was like, what? I was like, yeah. And then I started talking to some other people. It's like, yeah, man, you're a 94 kilo lifter. And um for the first time, as a sense of my body goes, it just put so much less emphasis on the way I looked or trying to be someone that I'm not, and like trying to
Yes,
fit that square peg in a round hole,
absolutely.
and or round hole in a square, I don't know, whatever the saying
Whatever the
is.
saying is.
It works both
A-
ways.
Anyways, that was the first time I really felt like my body was where it was supposed to be, instead of being someone that was, always staring in the mirror, looking for abs, looking
Sure.
for validation from others that I was leaning out or bulking up and gaining muscle. Like, it was like, no, this is a sport where you need to be at this weight class. This is where you belong. And it's like that
Yeah.
sense of just, I don't need to try to be something other than I am now, which I
Yeah.
think is a really healthy place to be, because it takes the focus off of me having to look a certain way and me actually just being an athlete and performing and letting my body does what it needs while still
Yeah.
eating healthy and maintaining other health variables. But it psychologically is just such a less stressful sport in that sense of needing to look a certain way for the external validation or approval of others, because even at the highest level of bodybuilding, you're judged. It's all
Yeah.
it's all a subjective judgment
Yeah,
to
It
it's
is.
a
really just
degree.
judging the body. That's what
It
it is.
is.
So that's a hard thing to get into too, especially when like everything is happening. You know what I mean?
Yeah. I think bodybuilding has its pros and cons. And I know we talked a little bit about this on your podcast. And I never want to come across like I'm bashing bodybuilding, because it did a lot for me. It actually got me my career. It got me into so many things. I learned so much from it. But I think bodybuilding has a lot more toxicity than it does positivity for most individuals. And it sounds like to me, when you found Olympic weightlifting, you were able to kind of accept what I would call your body weight set point, like where your body thrived. It was maybe a little bit easier to maintain there. You didn't have to be so rigid with your diet or your cardio in order to maintain it that way. And you could eat to fuel your body. And would you say that when you were bodybuilding, you spent a lot of your time like in a cutting phase, maybe restricting calories, doing more excessive cardio? Yeah. Yeah.
Yeah, I would spend, hours and hours in the gym, and I was younger too, so it was like I had time, but it was also like that factor that just more is better, and
Yeah.
I didn't feel good enough. And there's no way to really track that besides your own subjective feeling on it, when the strength sports have an objective. So instead of being subjective, there's
Yeah.
an objective measure, is, every few weeks, am I able to put more weight on the bar? Am I tolerating more volume? And then it's like, oh, that's the goal of this sport. So yeah, let's just keep fucking doing that, instead of
Absolutely.
like, oh, my abs look, you know, filled up and not the
Crispy.
washboard. Yeah.
Mhm.
Yeah, they're not as crispy today.
Yeah. No, I think switching to a more performance-based sport is a very beneficial thing for most folks in their mental. And I'm really happy that you found that positivity in that sport. And it also helped with your time crunch during grad school and all of that as well, which I totally get. I know they tell us in dietetics, like, don't work more than 10 hours a week. And here I was sneaking 40-hour work weeks. And they found out at the end and they were like, oh my gosh, like, of course you're so burnt out. And that's why you're not bringing lunch to your internship. And they're all worried about you. And I'm like, yeah, I'm sorry. So I totally get that. But I'm happy you found it. And maybe it was inspired by competing with your ex girlfriend, but it was a good thing. It ended up being positive.
Yes, for sure.
Amazing. I love it. Very cool. So, Brett, if you had to give any piece of advice to somebody that's looking to get into physical therapy, what would be your number one piece of advice for them? It's a
Don't
hard
do
question.
don't do it,
Don't do it.
unless you're very set on that. So people think they're going to go to PT school and they're going to know everything there is to know because you end up with your doctorate. The truth is, PT school is actually a very generalistic approach to physical rehabilitation. So people don't realize it, but as a physical therapist, we don't just work with, knee replacements, knee pain and shoulder pain and post surgically. Um, we work with a lot of neurological disorders. So Parkinson's disease, strokes, traumatic brain injuries, and multiple sclerosis, all those types of disease. We work, and so like our schooling has a very broad range of topics. So there's bariatrics, geriatrics, pediatrics, neurology, anatomy, musculoskeletal system, cardiopulmonary physical therapy. So we're working with emphysema, COPD, all kinds of breathing disorders and things too. So, and we work in what we call the allied health profession. So we're supposed to be able to work with nurses, doctors, any other type of provider that's in the traditional medical model. So if you're into bodybuilding things, a lot of people want to go into like sports orthopedic stuff. PT school is like the surface level of that, because at the end of the day, PT school is teaching you how to defend yourself if shit hits the fan and someone tries to sue you. It's not
Okay.
teaching you how to be a good physical therapist. It's really
Mm,
only teaching you what not to do. So if you want to be a
okay.
good physical therapist, there's a lot of continuing ed you need to do after the fact.
Yeah. Yeah.
Um, and the other piece too is, that's just a sad truth of our field right now, is we're massively underpaid. So
Yes.
the debt to income ratio for a physical therapist is actually very poor,
Crazy.
of especially too. So some people want to go to, private schools like Boston University or something like
Yeah.
that. And at the end of the day, the sad truth we all have to come to terms with is, in the traditional model, um, we're all studying for the same federal board exam,
Yeah.
and we all have to take that exam. So every school is preparing you to take that exam at the end of the day.
Yeah.
Every school wants to say we have 100% board pass rate and a 0% failure rate. So they want you to do well on that exam, and that's the main thing that they're worried about. The other piece to that is Blue Cross, Blue Shield, Harvard Pilgrim, Tufts. They don't care that you have a 2-year residency, 2-year fellowship, all these extra certifications. Those will make you they can make you a great physical therapist, but Blue Cross is reimbursing everyone the same.
Yeah.
And so when you go into a business as well, if you go work in a clinic, you might get a little extra for that. However, um, each year Medicare keeps cutting the reimbursement rate for physical therapy, and almost every private health insurance company bases their rates off of Medicare. So when Medicare
Okay.
dropped their rate 8% in the last 2 years, every other health insurance company did too. So what happens to the business is, we need to see more patients, we need to see them
Yeah.
for less time, and then they put more restraints on, we need more stringent documentation from you, we're going to deny more claims, this and that. And so we've gotten busier and busier in the field doing documentation,
Yeah.
jumping through hoops to get patients the care they need. And most physical therapists are burnt out. Like uh, my grad school roommate that was in school with me, he's now a landscaper making more money than he would as a physical therapist. I also have a friend
Okay.
that's a dental hygienist who has, a 2-year certification, I believe it is, that makes more money than most physical therapists do.
Wow.
Now, as a business owner and someone that came out, I started a cash practice. I work out of network.
Yeah.
I charge what I
Okay.
want.
Cool.
I do well for myself.
Yeah.
But I've also built a gym a bit. Like, I have 2 gyms, 2 physical therapy clinics, and I've worked outside of the traditional model. If you want that, sure, go ahead and do it. But also,
Yeah.
it's a hell of a lot of work that people don't realize it is. And I've seen a lot of people try, and then it's not what they bargained for, and they give up and they go into some other field.
Absolutely. I appreciate you sharing that with us, because I think a lot of people, they hear physical therapy and they're like, okay, I'm going to make a lot of money doing physical therapy. And it's like, it's not, it should be that case for every person that gets into the field, because physical therapists are such a crucial role to our healthcare system and just rehabilitation for all different sorts of cases. Like you just said, it's not just the bodybuilder that got hurt, benching. It's like the person with Parkinson's disease, and like you help from the aspect of neurological disorders and things of that nature. vastly underpaid, so much student loan debt. I have friends that are in the space as well, and I know that they've had similar complaints and similar feedback. And so to hear that you've been able to have, you have 4 locations, 4 physical locations, that's pretty freaking amazing. And
Thank you.
obviously, of course, it's a bit stressful, I'm sure, but what keeps you going on those hard days? What's your why as to why you keep going on those hard days?
Well, I want to back up for a second and say too that a lot of the issues that physical therapists or aspiring physical therapists face is they come out with this idea and all this knowledge of things they can do to help people. And they might be a great physical therapist, but like I felt really constrained. My last clinical rotation I did, I had a great mentor and everything, and he did his best to be a business owner. But like I was treating a lot of firefighters and stuff, and the heaviest thing I had in the clinic was a 10-pound dumbbell, or I could fill a milk crate full of dumbbells to have them do like a a, a milk crate deadlift, I guess. And so
Sure.
there's so much you can try to think you can do for someone, but then the restraints of the medical model of I'm seeing 28 patients a day and all this has made it to the point where a lot of people now too come to people like me that are a cash-based service because they're sick of not being challenged, not being heard, not being listened to, working with a burnt out physical therapist because it's just not working for anyone anymore. So
Yeah,
I'm curious to see what the field has, but anyways, so I just wanted to add that. But what keeps me going
absolutely.
is I just have a lot of pride in I'm very proud of what we've created and um like I went back the other day and I was looking for something for our marketing campaigns and I was reading through our Google reviews and like we have some awesome Google reviews and like we've been a place that so many people have come after seeing 2 or 3 physical therapists and a chiropractor and a surgeon and pain management and all this. And the problem is no one's taken the time to listen and understand to this person and give them the education and tools they need to truly get better. And we're able to do that with people, which has been the biggest differentiator for us, which makes us so different. Um, and that's really the thing that like keeps me going every day, regardless of what might hit the fan that day as far as just running a business. But um, knowing that we are making a difference and that like one of my goals is try to transform healthcare from
Yes.
an education standpoint and just by kind of being one of the first people to, not that I'm the first, but one of the early adopters of this cash and out of network model where we can treat
Yeah.
completely differently and give people the care they need and deserve and not just what the traditional model that everyone wants to siphon you into has to offer.
Absolutely. That's awesome. That's impact right there. Like that's huge. You're really an innovator in your space and your field. And I think that anybody listening that is interested in the physical therapy field, go reach out to Brett on Instagram, pick his brain, see if maybe you can get an internship there. I don't know if you hold interns there, but it sounds like
We
that's
do.
the place to go. You're the person to go and learn from because you've done the traditional school, the academia, we all have to do it, but you're creating a new system within your field to best service your patients. You're delivering patient-centered care. And I feel like we don't see that enough. And of course, our healthcare model can impede that quite a bit, and it's limited for a lot of practitioners. But you're going out and you're doing the thing, and that's freaking awesome. I love it.
Yeah.
Very
I
cool.
think healthcare
Awesome.
goes back so far that it's so installed in everyone's brain that it's like, oh, this is how it is. This is, but you're really changing that. You're changing the the level. You're changing the standard, basically.
Yeah,
So people
raising the
see
standard.
that and hopefully will follow suit.
Yeah,
Absolutely,
absolutely.
absolutely. I love it. So I want to pick your brain a little bit about training because we at TM, we've changed a lot over the years. Let me make that clear. If you were talking to me 5 years ago, TM was like train to failure, every single set, die on that hack squat and don't come back. But I want to hear more about your training philosophy with your clients and what kind of training style you primarily utilize. So if you use kind of like functional style training, if you use calisthenics, if you use kind of bodybuilding hypertrophy style, what does that style of training look like for the majority of your clients?
I don't I don't believe in any certain type of style of training per se. I'm going to base all of my training off of principles.
Yeah.
So we have to look at the person, we have to look at what they're capable of, what their goal is, what their training age is, what their time is, and their understanding of things, and really start from there. So, for someone that's early on in training and maybe they're a little bit older too, like it might be a calisthenic TRX, modified body weight type workout to get started. And then we might
Or
introduce them to kettlebells and things, right? But um so it really just depends, and I don't like to pigeonhole myself into using any type of method, or we're a gym that only does west side or
yeah.
conjugate or um what's his face? The big like submax powerlifting type stuff.
Okay.
Um it really tends to be, meet the person where they're at. And for different goals, there's going to be different things. So, um, for powerlifting, it depends on the person. So I have plenty of people I write programs for very differently because of their psyche. So, for some people, RPE or rate of perceived exertion training works great. A lot of
Okay.
times it might be we work up to a top set at an 8 where they could do, it's a hard set where they could maybe do or where they could do 2 more reps, with, you know and that's where we start to see their technique start to fall off a little bit about that 8, and then they'll do drop sets from there to just build the volume and capacity that their body can handle with stress and force over time. But then I
Yeah.
have other people that have no idea how to use RPE. Like it doesn't exist. Like I have one kid that only knows how to go to an 11,
Okay.
and it's like Spinal Tap, where
Yeah.
for him, I have to give him percentages because he needs to stay in those lanes. If I need to just guide him on like he has no sense of like how to manage load. He was a football player and just like he really
Okay.
knows how to like jack himself up and like bring
Yeah.
every motor unit in at once, which isn't
Yeah.
always healthy. Like it's great for
Sure.
competition, but
Yeah.
day-to-day training, like he would get banged up more so if I let him
Yeah.
choose his RPE because he doesn't actually know how to choose it. So some of
Yeah.
that depends
Okay.
on that. But then you mentioned training to failure
Yeah.
versus using RPE.
Yeah.
So are you talking more in a sense of bodybuilding?
Yes, more so in the lane of bodybuilding when it comes to hypertrophy training.
So RPE versus training to failure, I think they both have their place. I
Yeah.
think there's some good data out there that shows training to failure does have some type of neurological or neurophysiological effect on muscle tissue that is going to create the hypertrophy of a cell. However, we also have to think of long-term sustainability because in bodybuilding, it's not a quick fix, right? We know
Yeah.
bodybuilding's a long game. So
Absolutely.
when we're looking at our training and the way people are training, and it's something we do, is a lot of times when I have a bodybuilder come in, I tell them to stick around in the gym and I want them to do a workout because I want to see how they train and what they're doing because that brings so much to my eyes as far as are you, A, what does your program look like and what does the volume there look like? But how are you interpreting that program and how are you executing and applying that program? Because there are guys that will train to failure every set, every rep, every session. And if we're doing that all the time, for one, and comes from my performance background too, of like objective measures, and this goes for hypertrophy too, of people need to realize we're breaking tissue down in the gym, we're making ourselves more tired. And so if you're on your 4th exercise and you've been making yourself more and more tired every time and you're already tired and then still trying to make yourself more tired, bad
Yeah.
things are probably going to happen.
There you go.
So the issue with training to failure in that sense is what we start to see from my perspective is that when we start to get fatigued, we're going to start to compensate differently with different muscle groups and different firing patterns of muscle groups. And we're going to shorten our range of motion. So I think that it doesn't have to be an acute effect, but something chronically that builds up and then you end up in my office over time is that you did so much metabolic damage to your tissue, right? That things are sore and stiff for a week and you can't move. So you do chest on Monday and it's like you're sore for 3-4 days. You don't have access to your full range of motion now. So now we're starting to cut down on range of motion and then do that week after week after week. And now we start to see dysfunction in the shoulder, in the tissue, and we start half repping everything, and then we're not even stretching the tissue anymore when we're loading it. So that's where I start to see issues with training to failure. So I think there's a dose response there of, I think we could probably do it healthy where we're doing maybe 1 to 2 top sets of our main compound lifts for the day. And then from there, we're doing some more sub maximal training in some percentage range or something that's not complete failure every time, or use eccentrics and things where you're going back in those drop sets and in doing an eccentric, like you're getting a full stretch and holding it and even like breathing and then really bringing it back a little bit further and letting like your pecs open back up by the end of a training session instead of just continually pounding away and away. On the other hand, RPE can be great, but again, we need to know how to use it. And with RPE, right, we really use that for performance a lot because, and that's kind of the difference of part of the goal of bodybuilding is to kind of make yourself tired. Like you want to leave the gym tired, where when you're getting towards the elite level of being a strength athlete, you might not know it at first because like a lot of people will come from bodybuilding or CrossFit and their goal has been to make themselves tired. But now that it's starting to be a performance thing, it's like, well, if I make myself really tired on Monday, you start to realize my Tuesday workout starts to suffer. And then if my Tuesday workout suffers, well, then like I missed those, like making those lifts challenging enough to get something. So the goal is to do well, to create strength adaptation without while minimally making yourself tired, depending on the training block you're into or where you're at from competition. Because like in weightlifting, like Saturday is our heavy day where we're going to do more near maximal lifts. You don't want to be tired on Saturday. So if you train hard Monday, Tuesday, Wednesday, Thursday, your Saturday is going to suck. And we're not getting a good measure of it. So that's where we can use RPE training to make sure, maybe Monday and Tuesday is a little bit higher. Not max, but up there in the 8s or so. And then maybe Thursday is a 6 or 7 day before Saturday's workout.
Okay.
And as far as bodybuilding goes, I think most people should be in that like 8 range or so, because a lot of this physiologically just comes down to stress. Can we put more and more stress on the body? And if we're accumulating volume over time, we will see adaptation, especially if we're training at hypertrophy range. But it can't be like a 5 either. It needs to be a significant level. So we want to be training probably for the most part around an 8 out of 10 difficulty with 1 or 2 sets that are up there in weight. Also, I don't look like a bodybuilder right now. I just have been doing this for a long time.
You look like a bodybuilder. What do you say? You look like a bodybuilder.
Yes.
But I was going to also ask. Oh, go ahead, Kate. Go ahead.
I was going to say, to build off of that, I wanted to ask like 3 tips that you would have for someone to prevent injuries, like what you were saying with training to failure, when you're moving that, you're losing that range of motion, and then it ends up just really messing up the shoulder and all these things. What are some 3 tips that you have that would prevent injuries that you would give someone?
The number one thing to prevent injury is by far, and this is what the literature states, is load management. So this is the hardest part with bodybuilders, it seems like, and CrossFitters too, not to call you guys out, but if we can measure it, we can manage it, and what gets measured gets managed. And so we know from the data in our literature of injury is if we increase more than 10% load or volume per week, there's a very much increased likelihood of the risk of injury. So making sure when we're training, even if you're having a good, you did X workout and the next week you feel really good and you feel like you could do 20% more, don't. Stick to 10%, right? Maybe not go to failure that week. because just because you're feeling good today, maybe you had better sleep, whatever, but that accumulation of stress through the week and through the month builds up. So we need to measure that and just make sure we're going in an upwardly trending direction, not that we're trying to max out all the time. So that's number
Sure.
one. Number two would be train within your available range of motion. So, but also expose yourself to greater ranges of motion. So one of the hard parts of bodybuilding is most people, especially men, are becoming more muscle bound and they just get these stiffer end ranges of motion where maybe the shoulder doesn't fully go overhead anymore. Yet guys are trying to force their way up there. So
Yeah.
we don't want to train heavy. A joint doesn't want to be forced to go to end range. It should be able to
Okay.
live there comfortably. So
Okay.
if you have issues, say, let's say it's going overhead, well, maybe we shouldn't be pressing overhead. Like maybe I should be doing exercises or some type of mobility training to improve my ability to go overhead, and exposing it at very submaximal loads, like working out with isometric, like doing what we call pails rails for shoulder flexion.
Okay.
But we should be training within our strike zone of what's available. So if you have that available range of motion, like maybe a landmine press is better for you or something, or
Okay.
a modified incline press where you're not trying to do a military press when you have no business being overhead.
Sure.
Because that's when we see all these guys start to get shoulder pain, like especially, biceps,
Yeah.
delts, pecs. Those things all start to get worn out on people because their shoulder doesn't move normally anymore because of the way they've been training. But then I would say at a very submax level, yeah, try to do something to get that bar overhead, or like even at the bottom range, like a lot of people like only bring the dumbbell like where their thumb is in line with their ear. Like try to do some stuff to like, bring maybe a little bit of a lighter
Okay.
dumbbell all the way down to your shoulder and use every bit of range of motion you have. Because if you look at the difference in, I'm gonna use this extreme example, but Olympic lifters versus power lifters, right? Olympic lifters can be very strong. They can look very fit too. And I actually want to highlight on something that too, with the differences in
Yeah.
like the physiques of weightlifters and power lifters.
Yeah. Let's do it.
But
Yeah.
but if we go through that whole range of motion, like if you look at a weightlifter, we're training our full range every day, right? We're squatting every day. Every day is leg day as a weightlifter. You have cleans,
Yeah.
snatches, overhead squats, front squats, deadlifts, all that stuff. We're still doing all that stuff. Yet we don't see this lack of range of motion because we're training it every day, right? We're getting into these end ranges of position and we're slowly adapting to them where we're getting comfortable with them. Where
Okay.
bodybuilders and maybe even powerlifters aren't training this full range of motion every day. They're only strong in the positions
Sure.
they train. So they're actually starting to lose their mobility. So we can't think of strength training as something that's going to lose your mobility. It's just
Yeah.
what way are you utilizing the tool of strength training? Because
Right.
if you think about it, it's active stretching too.
It
It's just,
is.
it's just what happens sometimes is if you took an elastic band, right? If you pull it long and hard enough, it will eventually snap. So
Yeah.
who has the better tissue quality is the one that's going to train to a full range of motion every day versus the
Yeah.
one that's only training half of that. Because if you think of a band too, the further and further you pull it, the increased likelihood it's going to snap. So what we see a lot with bodybuilders, powerlifters, is they're doing an exercise and then they get towards that end range of motion. Let's think of like a Romanian deadlift here,
Sure.
right? They're shooting their hips back in that hip hinge.
Yeah.
They might not, might have very tight hamstrings, and all of a sudden, so the actual strength capability of it is less at its end range, and that's where we see injuries start to occur.
Okay.
So doing things to
Very,
improve our ability to tolerate load at end range is really important.
that's really good to know.
And
Really
then
good to know.
the third piece there is that stretching is not the answer.
I was hoping you'd say that.
Stretching not needed.
too many people try to stretch away their injuries because they just go to the doctor and the doctor says, stop doing this and just stretch.
Right.
It's not the answer. So a lot of people, now for some people, stretching is the answer,
Yeah.
but usually that's not the reason they got hurt in the first place.
Okay.
Because if you take a tight band and just try to make it tighter, it just makes it tighter.
Great.
Right. And so it's not usually stretching, it's usually some type of, we need to increase load tolerance. So stretching is one way to do that, but sometimes it's strengthening,
Yeah.
especially at or towards end range, improving the mobility of the joint. But also for a lot of people, it's a stability issue where
Yeah.
they need to have better control. So gymnasts, dancers, cheerleaders, all of those types of people, especially just a lot more females in general than males, but they might have all this passive range of motion. Like I lay you on your back, I stretch your hamstring, and you say your hamstrings feel tight, but I could bring your foot to like the level of your head. Your hamstring isn't
Sure.
tight. The sensation is that it's tight because you don't have active range of control. Because when I ask you to raise your leg up to 90 degrees, you can't do it. So what is happening with
Okay.
this other 40 degrees or 50 degrees of range of motion that you have no control over? Your brain neurologically is saying stop and creating stiffness. And really, what I'm trying to get to here is sleep and hydration together will 2x your return on decreasing the risk of injury. So if you look at
Okay.
stress, sleep, hydration, those are our big three. Of
Okay.
we'll see NCAA athletes with a 2x injury rate during finals and midterms. See people when they get
Makes
sick,
sense.
2x of that. And when sleep is decreased less than 6 hours, I believe the number is 6 hours, we see rapid increases in the level of injuries where stretching does almost nothing to prevent injuries.
Wow. Would you look at that? Comes back to stress every time, doesn't it?
Everything.
Everything's
Really
rooted in
does.
stress.
Yeah. Right.
Yep.
Stress, lack of sleep, and hydration. So it just highlights the importance of also probably good nutrition too, making sure you have enough fuel to
Yep.
recover
Yeah.
and do the thing and support your body to do the thing. Um, that's awesome. Those are great tips. Thank you, Brett. And one question I have, just honestly for my own personal, you probably heard like the endless debate of is it volume or is it intensity that is best for muscle growth? I would love to hear your perspective on that kind of argument in terms of what is most important. Is it the volume or the intensity of the training?
I honestly can't say I know too much about that at this
Yeah.
point. I mean,
Okay.
but at least what's going on in the literature with like bodybuilding. So I'm kind of out of that phase of my career as I've been focused more on weightlifting and powerlifting. But I mean, from my coaching perspective and what most coaches will do at the elite level is we're going to, if someone needs to put on mass, they're going to get volume. They're going to get um, high repetition sets. So yeah, you're in that
Okay.
8 to 12 rep range, and it
Sure.
usually works because in weightlifting, like I have some girls that have a very muscular physique and they have that mesomorphic type quality to them. Some people will run into issues when we start to add more of that high repetition training because they're pushing past their weight class.
Sure.
Where if we
Okay.
keep the load, the intensity lower, they're going to get more of that strength adaptation, but the muscle cells aren't going to get hypertrophied as much. So when we're training in those lower ranges, you will get stronger. And it's a forward feeding loop,
Yeah.
or positive feedback loop of, well, if I get stronger, I can then do more weight and then I can increase my volume and maybe put on muscle if that's the goal. Right. But in general, um, if you're in that like 5 or less rep range, you're going to see more adaptations of neurological strength because you can get much stronger. You'll see it with newbies of the first 12 weeks of anyone's new program,
Yeah.
or if they're new to training, rather, they're going to have significant gains in strength because it's all neurological. You're not
Mhm.
going to see that with someone that's more adapted to training, but it just goes to show how powerful stimulating the nervous system is in some of these people. And then yeah, you can see some very strong people too, just genetically might be strong and trained for strength that don't have a lot of muscle mass.
Yeah. Yeah. No, that's really interesting. I love hearing your perspective because I feel like that's one of the endless debates that we hear, at least in the bodybuilding space. And I'm kind of stepping out of that, but it's always up to my curiosity there. So I appreciate
I,
your perspective.
I think we kind of had talked about this before, Kelly, too, though, like when we were talking about cardio, you'll
Yeah.
see people do better with cardio if they've plateaued with their cardio and their weight
Yes.
loss of pausing for
Yes.
2 weeks, right? And then going back to it. So I think
Yep.
part of it might be if you're always trying to stimulate hypertrophy, we probably reach our genetic set point where
Yeah.
let's change the stimulus for a little bit, change the stress, get some new adaptations, and then go back to it and then start that cycle over. And it might be more successful that way.
Absolutely. Yeah, like changing up the training style. Like, and I don't actually do my own training anymore for my clients. I've actually outsourced recently. This week we put that into place, which is pretty cool. But when I would program for people and I'd work with them for years at a time, I would try to change up like the amount of volume that they had and kind of mess around with the training schemes, in terms of drop sets, intensifiers, cluster sets, and just try to give their body something a little new so that they're not always adapting to what we're doing. And I think it worked well. And I think that a lot of the body, when it comes to nutrition, training, is kind of just like fighting adaptation and finding ways to overcome that adaptation in creative ways. So I appreciate that perspective a ton. Thanks. Kate, I'm going to have you start rapid firing our awesome questions here for Brett, if you don't mind.
Yeah.
And we'll kind of dive in.
So, Brett, thoughts on regular massages or versus foam rolling? So, this is the thing. I got massages maybe every month, and they really did help me. But I wanted to hear your opinion on what you think or how you think that would help people, or if it wouldn't help people, and just your opinion on that.
If massages help people?
Yeah, if it's like preventative and injuries and all these things. Just your, if you like it.
It's a tough, that's a tough thing to say because there's so many things that we can look at happening with it. So, in general, is it going to hurt to get a massage? No. Do people get hurt getting massages? Yes, sometimes. Because back to like the gymnast, dancers, cheerleaders thing, if your joint, and what we see a lot of times, if a joint inherently is very mobile, but you don't have control of that joint, your body is going to create neurological stiffness in the tissue around it, where it's going to limit the range of motion where you don't have control. People will go to a massage therapist and get massage to loosen up all the tension they feel. And now we've taken some of that tension away, at least temporarily, from these areas. And now we might be lifting heavyish weights in positions that we don't own. So that protective mechanism might have been there for a reason. And now we've lost that protective mechanism. And now we're going to train in these ranges that now we might expose ourselves to issues with. And so this is something in rehab too, at more people that are doing anything really elite. We don't want to make a lot of drastic or aggressive types of tissue work or mobility gains, especially near competition, because you're only strong in the positions you train. So if you have all this new mobility, but you've done nothing to stabilize that and learn to be stable and controlled in those ranges of motion, you're more apt to get hurt. Now, in the same breath, there's plenty of us that could benefit from doing massage because foam rolling in itself, if it makes you feel good, great. But there is a difference to having someone put their hands on you and you being able to be relaxed. There's a lot of people just mash themselves with a foam roller. And like, if you're grimacing and grinding your face, like you're just actually creating more tension in your body. That's going to temporarily change the input. But when you're foam rolling, you should be able to be relaxed. You should notice your forehead is drawn down, almost like you're meditating. We should be able to breathe
Okay.
slowly through our nose and do nasal breathing. And we can get some effect from foam rolling in that way and just maintaining, you know, some tissue quality and things. But there is a difference of, and even when we do it, so we use some metal like Graston tools versus our hands. There's a different effect that happens in the muscle tissue with that. So there's something to from person to person, like hand to hand contact, that's going to change. And then also having someone that's well trained in this, that knows how to feel the feedback of the tissue and what the tissue is telling them. And just sometimes too, getting into certain areas, like I can grasp my hand around something where like I can just roll a roller flat on it. So there's that
Yeah.
difference of what you can do with your hands, and just foam rolling is like a general umbrella you can do. But sometimes a massage therapist can like get into these areas and things. And the other thing we need to look at too is maybe you're doing a few minutes of foam rolling pre-workout, which is totally fine. Um, if you're going for a massage, it is healthy in the sense that you're giving yourself an hour of self-care, maybe to relax, de-stress. And then your parasympathetic nervous system is going to kind of come on, and sympathetic might shut off a little bit. You might sleep better that night. So
Mhm.
there's a lot of altered effects we can see from massage that isn't just related to mobility as well. I want to always know what alternative treatments are out there for my
Yeah.
patients. So I didn't even do it for my gut health. I did it for like a stress management thing and seeing if I could come to any new giant ideas to fruition or whatever.
Sure.
But that was a very welcomed side effect. Was I did it a few times and really noticed changes in my GI symptoms, and like I'd be going to the bathroom half as many times a day now and all these things. And it's really just helped me from, yes, my kind of nervous system, it doesn't get ramped up with like the little stressors anymore of like,
Yeah.
oh no, there's no ruminating or catastrophizing as much, which I think has really changed it. And there's actually, I had looked up some studies. It looks like there are some promising studies out there where there are studies showing ketamine can change the microbiota of the gut.
Yes. Really cool stuff happening with ketamine right now. I recently, my mentor for eating disorders, she posted the official systematic review of psychedelics and eating disorder treatment. And when I was in my eating disorder internship, inpatient residential, like the sickest of the sick people that could never get out of their eating disorder, their frequent flyers in treatment, they would then go forward with ketamine treatment. And I remember speaking with one patient who the ketamine treatment changed her life. Like she had one of the most severe eating disorders we had ever seen in the clinic. And she was going home. She was happy. She was healthy. She was weight restored. She wasn't freaking out about her ED and the weight gain. And it was like absolutely incredible. So I am so fascinated about what else we can find in terms of potential treatments with the use of ketamine, but also psychedelics in general. I think that the alternative therapies, alternative medicine, definitely has its place, but you definitely want to do it legally with a practitioner. You don't want to go to like some guy off the street and go get your ketamine. Please go see a doctor if you're going to even consider this. But I appreciate your transparency and your vulnerability as well, sharing that with us. And I think it's a very, very cool side effect that you got from that was seeing your IBS improve. But I'm glad that it helped you with the stress management and anxiety as well. That's
Yeah.
incredible.
I'll say too, like before I did it, there's a lot of it's a psychedelic. I've never done psychedelics before. I was pretty
Yeah,
nervous to do it. Um,
sure.
and it is this new field and it's growing and getting more popular. But there are a lot of issues with it too, where it's used for all kinds of different issues. So, and people are confused about ketamine too. So, um, it has very different uses and very different doses. So, it's used as a party drug, a psychedelic. It's also used in anesthesia.
Yeah.
And I forget the other one. But anyways, there are clinics now. You can just do this remotely telehealth from your home, which is what I do now. But a lot of these clinics are just incentivized to give out ketamine to whoever, and there's no regulation of it, of how much you're doing it, what dosage you should be taking. There is ketamine can increase your blood pressure. If there's any heart condition or underlying heart condition, we need to worry about those things. Peter Attia on the Drive podcast has an
Okay.
awesome an awesome podcast about it if someone's considering this, because it is new and popular and people are talking about it now. Go listen to that podcast because he brings up all the potential issues with it too, that I think is things people should hear, not just the good about it, but like there are potential downsides.
Absolutely. Like with anything else, with any medication, with any
Yeah.
treatment, you know? So educate yourself for sure. But I appreciate you sharing that experience. Pretty cool to hear. And I want you to plug away, Brett. This has been such an awesome conversation. I learned so much from you today that I can take with my clients and just into my own training and my own life. So I appreciate you coming on.
Yeah. So I don't even know what it is. Let's see.
I know, right? When you get that question, what's my name?
If someone wants to reach out to me personally,
Yeah.
my name is Brett Scott. So my Instagram handle is Dr. So Dr. Coach _BS. So Dr. Coach BS. And then if you're interested in rehab, we're at barbell.therapy. And then if you're interested in our fitness side, whether it be weightlifting, powerlifting, or even just general fitness, we coach a lot of people that are in their 40s or so and just looking to lose weight. That is Architect or at Architect Fitness. So ARKITECTFITNESS.
There
Or
you go.
Barbell Therapy, barbelltherapyandperformance.com, architectfitness.com. Any of those work. My email is brett@barbelltherapyandperformance.com because someone stole the barbell therapy domain for about $15,000. So,
My goodness.
we just
Crazy.
we're going to continue with long emails until
Yeah.
I can get it for cheaper. So,
Yeah, I mean, save the 15K and we'll link everything. We'll put all of your info in the show notes and you guys can find Brett there and we'd be happy to chat with you for any of your needs, any questions.
absolutely.
Thank
Well,
you
thank you
again for
guys.
coming on.
No
Thank you
problem.
so much.